Oh, hello there. So, you're curious about choosing a postgraduate supervisor. Well, I'm glad you've come to me. I've been expecting you. As you can see, I'm spending some time with someone that I consider a mentor and whose dedication to management is no doubt one of the hallmarks of the foundation of the business I know you're hoping to build your bases on. Michael Scott. Here's a quote I know applies to supervision and what we're all really looking for. Quoted, "Would I rather be feared or loved? Easy. Both. I want people to be afraid of how much they love me." Well, I'm here to talk to you about some supervisor qualifications and how to choose a supervisor and what you should be thinking about in choosing a supervisor for yourself. A supervisor must be competent in the clinical specialty areas in which the registered associate will be practicing and with the populations with whom the registered associate will be providing professional counseling or marriage and family therapy services. A supervisor may not be a spouse or relative, have a close personal relationship, dual relationship, or be a former therapist of the supervisee. The board may approve supervisors on the registry, candidates and approved supervisors, or other qualifying supervisors who meet the criteria. If you would like to know more about how to become a postgraduate clinical supervisor in the state of Oregon, simply go to oregon.gov and look at the Board of Licensed Professional Counselors and Therapists for those requirements. Supervision is typically performed simultaneously by both the on-site supervisor and university faculty and a college or university faculty member for all field experiences. Supervision is evaluative, extends over time, and it has two purposes: to foster supervisees' professional development and to ensure client welfare. A brief investigation of clinical supervision for mental health professionals will show that it began much like apprenticeships in other fields. Essentially, a student or apprentice with minimal skill or knowledge would learn the work by observing, assisting, and receiving feedback from an accomplished member of that same field. Or, like this: I do, you watch, we do together, we talk, you do, I watch, we discuss, and then eventually you do alone. And it was believed that the master was quite good at the work, and if they were good, he or she would also be equally good at teaching or supervising. Well, in fact, this is not the case. Today we realize that though clinical supervision and counseling have much in common, e.g. the ability to engage in an interpersonal relationship, the two tasks also utilize separate and distinct skills. This means that a master clinician may not be always a master supervisor without the addition of training and competency in supervisory knowledge and skills. So in choosing a supervisor, you must consider more than just the person with experience in the field. More skill, knowledge, and training is needed. Now, for an in-depth look at best practices in clinical supervision, you can look at the work done by the Association for Counselor Education and Supervision, or ACES, to see what good supervision should include. A few of those things I'm going to talk about now, but if you want to know more, you can press into that work. So a good supervisor will provide a clear outline of what supervision will entail and will be expected of you as the supervisor, and what will be expected of you as the supervisee. You can think about it like doing a disclosure statement with a client. The supervisor should provide you with clear expectations, parameters, and an open discussion about fostering a supervisory working alliance. Supervision should include clear, objective, and measurable goals for you as the supervisee. A good supervisor is doing more than just signing a piece of paper that says you saw clients or worked the appropriate number of hours. You should become a better therapist under their guidance. Establishing goals and working toward them, just like we do with clients, is an absolute must. Now, a good supervisor should give regular and clear feedback. This should happen without overwhelming you. No more than 2 or 3 things should be worked on in a supervisory session. Your feedback should be both positive and constructive. If you find someone who seems to only find flaws, you may end up feeling very discouraged and discouraged in your progress as an intern. The feedback should also be varied in nature and not just focused in one area. All of us are learning that there are so many layers to this process. So finding someone who will help you grow as a whole counselor, not just in one area, is important. Your supervisor should be informed and show clear competence in all the professional standards of the counseling field. Getting supervision in triadic, group, and individual settings will be helpful in diversifying your learning experience and opportunities. When you see your supervisor helping another intern, make sure that you take notes, because there's a good chance that what you are hearing will one day apply to you. I would also add that a good supervisor will encourage each member of your supervision group to chime in and offer their own experience to help you. It shouldn't be a one-person show. Your supervisor should be someone that demonstrates unconditional positive regard, accurate empathy, and genuineness. Thank you, Carl Rogers, in the building of a working alliance. If you don't feel cared for, appreciated, or a part of the team, it may indicate that this supervisor is not offering you what you need to become an effective therapist. And remember, supervision is about you, not them. Your supervisor should be competent in multicultural considerations. In an initial session, the supervisor should introduce issues of culture, diversity, power dynamics, privilege, and advocacy. A full range of cultural factors need to be considered, including race, ethnicity, gender, sexual orientation, socioeconomic status, privilege, ability status, family characteristics and dynamics, country of origin, language, historical process, worldview, spirituality and religion, and personal values. That's a lot. But if your supervisor is insensitive or dismisses these things, it may be worth considering how this person will assist you on your own journey to caring for all of the above in your own practice. Your supervisor should be aware of all ethical considerations pertaining to the counseling profession. Legal and ethical issues are the things that tend to bind us up and create havoc in our professional lives if they're not properly attended to. Your supervisor should be familiar with and adhere to the ethical codes and guidelines endorsed by the American Counseling Association, the Association for Counselor Education and Supervision, and other ACA divisions, relevant credentialing bodies, and models of ethical behavior. Your supervisor needs accountability. That means that they maintain documentation that will, at a minimum, include your supervision contract, supervision session notes, and formative evaluations and goals for you as the supervisee. If your supervisor offers you feedback and evaluation, that means that they understand that it is their responsibility to help you make progress in that area. This is similar to making a diagnosis as a counselor. If you diagnose a client, then you're agreeing to treat that diagnosis. The same standard applies in supervision. The supervisor should be competent and experienced practitioner with knowledge in a wide range of theoretical orientations, techniques, and interventions. Experience with a wide range of population and experience that is relevant to the supervisee is more than advisable. In regards to choosing your own supervisor, I found several good questions that you should be asking in choosing a clinical supervisor for yourself. 1, what is their work experience? 2, what do they enjoy about supervision? 3, what do they see their role being as a supervisor? 4, what are your policies on accruing and tracking hours? 5, how do you evaluate your supervisee and yourself, if at all? So if you can ask those questions and get adequate answers, I think you'll be making sure that you found somebody that will fit well with you. I have also included a short video interviewing my personal supervisor, my clinical supervisor, and another Western student who's a little further in the program to talk about what they believe is the most important thing in choosing a clinical supervisor. Here with a fellow student and my supervisor. And so his name is Corey Jackson, and he's going to tell us just 2 or 3 things that you ought to look for in choosing a post-grad supervisor. All right, there's Corey.
So I think that picking a supervisor is a lot like picking a therapist. I think having a good fit is going to be really, really important. So, sometimes it takes a couple of times to find that right fit, but someone that fits with your theoretical orientation, with your overall philosophy of counseling, but also even just personality, sense of humor, all those sorts of things go a really, really long way. So I would say, just like your clients, sometimes finding the right fit is a really, really important thing. Same thing with picking a supervisor.
Awesome. Thanks, Corey.
Sure.
All right, and then I also have Dana. Dana, who's a student at Western, about to graduate, getting close.
Yeah, in the spring, yeah.
Awesome. Dana, what do you think about choosing a post-grad supervisor?
Yes, as someone who's only had one and now two supervisors, I think what was most important for me in my first experience was I'm a verbal processor and I need room to say stupid things and then sort them out and have someone to reflect.
Yeah.
So that was important to have that non-judgmental space. And then, yeah, like what Corey said, I think personality matches and someone to crack down what's important for those, legal and ethical lines, and then someone to help you figure out what the right way forward would be in those gray areas or
Awesome.
sticky areas, I guess.
Wonderful. Thanks, guys.